The strategies for safe movement of patients as shown in this video are general in nature. They can apply to many types of patients, but may need to be modified for certain diagnoses, impairments, or precautions that a given patient might have. Thus, for a specific patient, the strategies shown may need modification. If you are unsure of how to safely move an individual patient, it's recommended that you consult with the occupational or physical therapists at your facility. Whenever assisting a patient with movement, it is important to instruct the patient in ways that they can assist with the movement. If the patient knows what to expect because you are communicating with them, they are less likely to move in a way that may come as a surprise to you and throw off your own balance. Also, instructing them how to assist helps promote their independence in completing the movement and makes your job easier, as you may not have to provide as much physical assistance. This video is going to show how to assist someone into a supine position from sitting at the edge of the bed. Sometimes you will need to help patients scoot back further onto the bed prior to lying down. If that's the case, one strategy would be to assist her in essentially walking her pelvis backwards. Help the patient lean over to one side to unweight the opposite side of her pelvis. Some patients will then be able to shift the unweighted side of their pelvis back. Others may need some assistance, like what you see in this video. Next, remove the gait belt prior to initiating the movement into supine. Assuming you are assisting this patient back to bed from the bedside chair or from ambulating, she would have been wearing a gait belt. Then, raise the bed up so that you don't have to flex through your spine while assisting the patient into supine. To begin lying the patient down on her side, instruct her to lean down on her elbow using the arm that is closest to the head of the bed. She can also begin reaching across her body with the opposite hand. You may need to place one of your hands under her lowermost shoulder to assist in controlling the descent of her trunk. At the same time, begin assisting the patient in lifting her lower extremities onto the bed. This movement is most easily achieved if you have a wide stance and squat down while keeping your back straight. Then, simply rise out of the squat while holding onto her lower extremities. Once the patient is in side lying, assist her in rolling onto her back. For fall risk reduction, replace the bed rail. Also, lower the bed to its lowest position so if the patient gets up unattended, she isn't going to potentially fall from a bed that is high from the floor. Make sure the patient is comfortable in supine by ensuring she is positioned in the center of the bed, adjusting pillows, raising the head of the bed, or doing whatever other positioning may be indicated for that patient's diagnosis. Lastly, for fall risk reduction before you leave the room, ensure that personal items and a call light are within the patient's reach, and set the bed alarm if indicated for that patient. It would also be appropriate to remind the patient to call for assistance prior to getting out of bed. If two people are assisting with this transfer, they would position themselves on the same side of the bed. One caregiver would assist with the patient's legs, while the other would assist with the patient's trunk. In some cases during a sit-to-supine transfer, you might consider leaving the bed rail up, as some patients will be able to effectively utilize the bed rail to assist them in controlling their trunk as they lay down on their side. However, if you need to physically assist the patient a great deal, leaving the bed rail up will make it difficult to get close to your patient while maintaining a good back position. Additionally, if the patient will not have a bed rail at discharge, it is best to have them practice transferring back to bed using the similar method as what will be required after leaving the hospital.